I think the idea when intuitively we know that natural light, natural ventilation, conducive aesthetic and social conditions really have relevance in a very particular way in healthcare settings, but probably more importantly, they have relevance throughout other building types and other environmental settings. I'm Kent Spreckelmeyer from the University of Kansas School of Architecture, Design and Planning. I presented a paper about a project that we're doing at the Master of Architecture studio. It was a design of a hybrid hospital to affect the way that communities and healthcare systems can interact with each other. The student teams were asked a simple question, which was, if you were to take a critical access hospital, what would be the best way that you could integrate that hospital into a community and in some way expand the nature of what the hospital was doing? We had 3 student projects over a course of 6 weeks. The first project looked at the idea of taking networks within nature and applying those to a healthcare system so that all of the related information that comes from the community to the hospital could be integrated into a central system. The second scheme looked at the idea of taking some of the basic social conditions and features of the community and beginning to leverage those, or what they called creating a synergistic system. The third scheme was looking at a system that was dependent on the nature and the roots of agricultural industrialism, specifically using the railway system and other kinds of agricultural industrial processes to begin to think of a way in which the healthcare system could respond to needs in the future, whether expanding or decreasing. I think one of the things that we're finding, and the students that are participating in this program are coming from a fairly intensive 7-month professional internship, and one of the things that they're finding is that the way in which they view design is completely devoid of any notion of a particular building type. So for example, when most of their work has been in healthcare facilities, medical facilities, fairly detailed and complex specialized facilities, they're finding that those processes have a great deal of relevance in, for example, education or in residential settings, or in commercial settings that you wouldn't normally associate with healthcare architecture. So I think one of the most important things that we're finding is the way in which this idea of health and wellness transcends the whole idea of medicine or healthcare and begins to find relevance in environments that people intuitively know.